Welcome to Hello Doctor Talks. Today we are going to discuss about thyroid. To discuss more on this, today with us Dr. Balaji Patel Kola. Dr. Balaji Patel Kola, Senior Interventional Radiologist, Vice President for Interventional Radiology Society for India and Director in May1 Medical Center, Hyderabad. Doctor, what is thyroid gland and where it is located in the body?
Thyroid is an endocrine organ which is found in the front of the neck like a butterfly shape. So because it's an endocrine organ, it will secrete some hormones. Then the hormones regulates a lot of things in the body.
Doctor, what are the functions of thyroid gland?
I told you like thyroid is an endocrine organ. It secretes T3 and T4 hormones. These T3 and T4 are controlled by TSH, which is secreted by pituitary. So all these hormones together, what they do is they regulate the digestion, they regulate the absorption, they regulate the respiratory rate, they regulate the cardiovascular activity. So all these functions are done when these hormones are in a proper level in the body.
Doctor, what are the problems with thyroid?
Yeah, so we have just heard that, thyroid is an endocrine organ. It is secreting hormones. So hormones are doing some functions. Whenever these deficiency or whenever that's excreted in a large volume, then there is a disparity in the function. So what happens is, whenever these T3 and T4 hormones are excreted in a lesser levels, that is T3, T4 is less. So then all these functions what we just discussed will be less in activity. So when you see, it is called as hypothyroid. So in the hypothyroid, T3, T4 levels are less and TSH levels is more. So whatever activity these T3, T4 was doing, that activity will decrease. So heat regulation, so the body heat regulation is controlled by T3, T4. So whenever T3, T4 levels are low, you will be insensitive to cold. You will not be able to bear the cold. Then the respiratory rate will be lower. The cardiovascular activity will be lower. The patients will be gaining weight because the absorption is detained. The digestion is not happening properly. The absorption is not happening properly. So it is called as hypothyroid. Then there is another thing called as hyperthyroid, where these T3, T4 levels are more in the blood. That means that these hormones are excreted in a larger volume. So whatever function they were doing, they activate more. So the patient becomes heat intolerant, or the patient starts losing weight, and the patient might have excess of sweating. Patient might have loose motions. So whenever these hormones are not in proper level, we see all these activities in a different thing.
Doctor, what are the signs and symptoms of thyroid?
Yeah, we just discussed now, patient you commonly hear that, I have gained a lot of weight because I have thyroid. So in hypothyroid, as I told you, the digestion will not be normal. Patient will be having irregular periods. Patient will be having hair loss and irregular respiratory rate and the heart rate. So all these things, whenever you see in a patient hyper or hypo, they are like in hyper, you see loose motions. Hey, patient will have lesser respiratory rate and the cardiovascular activity. So all these things, whenever we see the signs and symptoms, we should suspect that there is some problem in thyroid and we should get tested for these things.
Doctor, nowadays thyroid problems are very common. And we hear that there is a problem like weight gain and how we can able to tackle it.
Yes, whenever you ask a patient, these young girls and these young patients, whenever you say why you're having excess weight, they say that, sir, I have thyroid problem. That's why I'm increasing in weight. You're right, because your basic metabolic rate is being decreased, because your activity is decreased, because your thyroid hormones are decreased. Whenever you are hypothyroid, your digestion, your absorption, everything is decreased and the patient gains weight. So these are common, very common. Hypothyroid is very common and it can be treated. Whenever you see this, you have to approach a doctor. You have to find the levels of T3, T4 and TSH in your blood, and you should also do an ultrasound. When you do an ultrasound, you will see if any abnormal nodules are there in your thyroid, whether your thyroid is increasing in size, if any abnormality is there, if nodules are there. then we have to also differentiate between thyroid cancer. Thyroid cancer has to be differentiated from the benign thyroid problems. So hypothyroid, hyperthyroid, and thyroid cancer, these are the problems which we can find in thyroid.
Doctor, what are thyroid nodules?
Yeah, so as we discussed, when patients know that they are suffering from hypothyroid or hyperthyroid, or because of thyroid malignancy, so patients will have some abnormal nodules in the thyroid. So these are very important because in benign condition, we see that these nodules will increase in size very lately. That means that the doubling time is maybe some months or years together. But when the thyroid nodule size is increasing very rapidly, then you have to suspect that there is an abnormality which is not benign. It can be malignant. So in ultrasound, when the patient is subjected to ultrasound, we can differentiate these nodules, whether they are benign, whether they're malignant, whether they're active. All these things, like we can see the vascularity, we can see the size, we can see the calcification. According to that, it is called as thyroid classification. In thyroid classification, if it is thyroid 1 or thyroid 2, that means it is more benign. If it is thyroid 3 and above, that means that there is a suspicion of malignancy. So we have to rule out that the patient is not suffering from thyroid cancer. So we have to do an FNAC to rule out that it is not thyroid cancer. And if it is even benign after that, we have to follow the patient every year. We have to do ultrasound. We have to see what is the size of the thyroid nodule, whether it is increasing, whether it is transforming into malignancy. So it is very important that we follow these thyroid nodules. You should not take it light. We should investigate. We should make it sure that these are only benign. These are not malignant.
Doctor, how common is thyroid cancer and how we can able to detect it?
Yes, very good question. See, what we are saying is we are afraid that this is not thyroid cancer. So how common it is? So if you take 100 patients who has got thyroid nodules or thyroid problem, 95% is benign. So it is very good news that it is not so common. But 5% is also a good number. So we cannot leave it. We cannot say that, because it's only 5%, so the possibility is less. Never. You have to do an ultrasound regularly. You have to find out that it's a malignant. If you have a suspicion that it's a malignant, then you have to do an FNAC to prove it. And you have to treat any malignancy or any cancer. You cannot leave it inside the body because it grows very rapidly. So even if it is 5%, you have to undergo FNAC, then find it out that it's a malignant, then obviously you have to go forward with the treatment immediately.
Doctor, does thyroid nodule require treatment?
Yes. See, thyroid nodule, as we discussed, it is benign and it's malignant. So if it is benign, so it grows in size. It might take months or it might take years to grow in size, but thyroid problem is something very common and it's a long-standing chronic disease. So in the meantime, maybe in a year or in 2 years, these thyroid nodules keep growing in size. So whenever thyroid grows beyond its size, it compresses the structures which are nearby thyroid. That might be major blood vessels, that might be esophagus, that might be trachea. So what does they do? Esophagus is something where we eat our food and we swallow our food. Trachea is something where we take breathing. So whenever these nodules increase in size, they compress over these structures. So what symptoms and signs you will see? You will see that there is a neck swelling, and then you will see that difficulty. Whenever the size increases, you will feel that difficulty to breathe, difficulty to swallow. So whenever these symptoms are happening, that means that the thyroid nodule is grown in such a big size that they are compressing the adjacent things. Then obviously you would require treatment. And the treatment was only surgery until now. But now we have microwave ablation, radiofrequency ablation. We put small needle through a small hole, and then we ablate that nodule and we come out. So please don't think that you have to undergo a surgery. You can leave a mark over here. Don't even think about it. Through a small pinhole, we can take care of these nodules. So whenever they grow in size, whenever you're seeing that the nodule is bigger than the normal thing, when we are seeing the neck swelling, then it's better you get treatment for these nodules. And these nodules, sometimes they can be malignant also. So let us rule it out. So don't just think that I have thyroid problem, nothing to worry about. You have to undergo an ultrasound very regularly to find out how many nodules are there, what is their size, how is the calcification, and then if FNAC required, you have to get the FNAC done. If it is euthyroid, that means that there is no abnormality in T3, T4, TSH, but still the nodules are there. Yes, we can do microwave ablation or radiofrequency ablation. And it's a daycare treatment. What I mean to say is, like, you can just walk in, get the treatment done, within 2 hours get discharged and get back to your life. And there is no mark on your skin, that you need not tell anybody that you have undergone the procedure. So it's very easy and you should not avoid it. You should get it done as soon as possible.
So we have covered all the questions related to thyroid. So if you have still doubts, kindly mention in the comment box.